Hi, I'm Clay Stamp, your Emergency Director for Talbot County.
And I'm Fredia Wadley, Health Officer for Talbot County.
We're here tonight at the Talbot County Emergency Operations Center, and what we're trying to do is a daily wrap-up for the Talbot County community to let you know some of the things that we are seeing, some of the issues that we're working on, just to keep you in the loop of what we're doing with the emerging infectious disease. Dr. Wadley's going to talk a little bit about it from her perspective.
Well, today we had in Maryland 349 cases reported. During the day, we also had our 4th death in Maryland. 4% of those cases, or around 14 cases, were on the Eastern Shore. Here in Talbot County, we've had 22 reports of tests done for COVID-19. Of those 22, 1 was positive, 21 negative. Keep in mind that the tests with the private labs take 5 to 7 days to get back. So these people were tested maybe a week ago, and they might have been exposed 2 to 14 days prior to that. So that's just to give you sort of the lag of what you're going to see when you get just reported cases. The estimate is that the U.S. is 1 to 3 weeks behind Italy or UK, and so that means that we're beginning to see the uptick and really expect that climb to be 1 to 3 weeks, a very solid spike. I hate to say it that way, but that's what it'll be.
Thank you, Dr. Wadley, and we're trying to keep our separation too, because that's something, that's our best defense against this spreading disease that we're seeing. So I want to take a minute just to tell you about your team here at the Emergency Operations Center. We have a dozen people that are working different issues. We have an individual that's working resource needs, logistics we call it. We're working on trying to obtain personal protective equipment for our priority groups, the hospital people, the health workers. So that's an area that we're working on. Operations are coordinating our operational work groups, the groups such as medical surge, to make sure that we do certain things to expand capacity, to make sure that we support our feeding work group, where we're feeding vulnerable populations. One of the areas that we need help right now is with volunteers. Those individuals that feel like that they would come out and want to do something. We have a portal that you can sign up on our talbotcovid19.org website, where you can volunteer and specify whether you want to help with feeding operations, whether you want to help with the medical sector. But this is an area that we're really trying to emphasize today. The other thing we're really trying to emphasize is support to the business community. The business community is really suffering with some of the things that they're having to do in order to really prepare us for this. So we really encourage people to eat out at or actually get takeouts from the restaurants. And again, we're trying to facilitate connection with our businesses in some of the grant and loan programs that will help them as well. Again, the thing that I would say, and I think Dr. Wadley would say, is that this is about sustainability at this point. We're under a state of emergency, and it's a strange time for folks. We want people to just stay in touch, be vigilant, continue to separate from each other as best you can. It's our best defense, but we have to just hang in here for the long haul. 1 to 3 weeks is a period of time where it's so critical. Each day we're going to do this wrap up, and we're just going to try to provide added value information to you. So when you watch this, if you have ideas, things that you want to hear us say that we might not have addressed today, you can send a note to eoc@talbotdes.org. Dr. Wadley?
And we want to remind you, if you have fever or any symptoms like a sore throat, cough, sneeze, stay at home. Then call your primary care provider and ask them for directions. We're urging people to do this, to call before they go, and we're urging them, if you don't have an emergency, if you're not having trouble breathing, don't go to the emergency room. We want to keep them open for those that might really have an emergency. So that's what I want to leave them with today.
Great. And so that really is a wrap up for today. We thank you very much, and we'll be back tomorrow evening with another wrap up.